Starting in pregnancy, every positive interaction between you and your baby makes them feel loved and secure, helping their brain to grow.
Hello, you. You're here.
You're home now.
I'm here.
Breastfeeding your baby meets their needs for comfort and nutrition all in one and has many benefits for you and your child. Your breast milk is perfectly designed to help your baby grow and develop. Breast milk has ingredients like antibodies, hormones, and stem cells to help protect your baby now and in the future. Breastfeeding isn't always an option for every family. If you can't or choose not to breastfeed and bottle feed with formula or express breast milk, you can still follow your child's needs and nurture them with affection through responsive feeding. Responsive feeding is giving your baby a feed when they show you signs they're hungry and stopping when they show you they're full. This makes your baby feel safe and cared for, supporting a close and loving bond between you and helping their brain to grow. It's normal for your newborn to want to feed frequently. Your baby is born with a tiny tummy and needs to feed little and often. This isn't a sign you don't have enough breast milk for your baby. Giving them formula will reduce your own milk supply. Your baby will show you signs they're hungry before they start to cry. Sticking out their tongue, smacking their lips, sucking on their fist, turning their head to find milk. When you bottle feed, make sure you hold your baby fairly upright, with their head supported so they can breathe and swallow comfortably. Babies shouldn't be flat on their backs or left alone with a propped up bottle when they're being fed, as they can choke. Hold the bottle flat with a slight tilt so they're not overwhelmed with the flow. Start by stroking your baby's top lip so they open their mouth and draw the teat in. Let them take the lead. Babies feed in bursts of sucking with short pauses to rest. When your baby slows down, lower the bottle slightly to stop the milk flowing. Let your baby pause and decide if they want to draw it in again. Giving your baby a break allows them to register how full they are and how much more they need, helping them to control how much they take. Talk to your baby gently and look into their eyes. This helps them to feel safe and loved. In the early weeks, to help your baby feel more secure, keep feeding as a special time between you and your baby. As your baby starts to feel full, you might notice they push out the teat or don't pull it back into their mouth, start dribbling milk, turn their head or push the bottle away, fall asleep. Once you think your baby has had enough, take the bottle away. Don't force your baby to finish a bottle, however tempting it is to have that last bit of milk gone. Just like us, babies have different appetites and needs, so sometimes their feeds are longer and sometimes they're shorter. Babies who are encouraged to keep feeding find it harder to regulate how much they eat and may gain weight too quickly as they grow, becoming overweight in later life. Responding to your baby and helping them take in as much milk as they need helps them grow in a way that's right for them. It's difficult to overfeed a breastfed baby because they have to actively suck to get milk. You can breastfeed any time for yours or your baby's comfort. Some breastfeeds will be longer and some shorter, depending on what your baby needs at that time, with around 8 to 10 feeds per day. Having 1 or 2 people feed your baby in the first few weeks helps your child feel safe and secure. There is support available however you want to feed your baby, including help to restart breastfeeding or to express breast milk. There's no need for you to eat any special food or drinks while breastfeeding. Just enjoy a healthy diet. If you're formula feeding, good hygiene and following NHS guidance is important when making up a feed to prevent illness. Speak to your midwife or health visitor for more information. Find support for you and your child along the journey from pregnancy to starting school, including how to contact your health visitor and where to find healthy child clinics, where you can talk to a member of the health visiting team. For advice and support, visit our Kent Baby website, family.kentcht.nhs.uk/baby.